Have you ever experienced a moment that truly shifted the way that you thought? For me, it was December 2019 when I was first diagnosed with rheumatoid arthritis and Sjogren's syndrome. And despite living what I thought was a healthy lifestyle, I faced the harsh reality that health disparities don't discriminate based on how well you take care of yourself. And it wasn't until I got that diagnosis that I began to understand something fundamental. Improving health outcomes doesn't just start with changing the individual, it begins with changing the system. And that's when I began writing for Enhanced Black Women's Health, because I truly believe that healthcare providers need to be equipped with strategies to challenge bias, reduce disparities, and deliver equitable care. And by doing so, we can improve health outcomes, especially for Black women. Hi, my name is Nisha Campbell, and my work is all about helping healthcare providers integrate actionable strategies to challenge bias, reduce healthcare disparities, and create patient-centered care services that serve Black women and all patients really equitably. And today I want to talk about how weight bias in healthcare fuels health disparities and what we can do to change it. Now, I care about this issue deeply, not just as a Black woman, but as someone who knows that improving the care of historically marginalized groups in this country means everyone's health improves. And it wasn't until my diagnosis that I truly understood how weight-centric our healthcare system is. Before my diagnosis, my GP was only concerned with the fact that my BMI was high. She didn't care what I ate. She never asked how I felt. It was just BMI, BMI, BMI. Because of that bias, she missed the symptoms of my autoimmune disease. And I was diagnosed 2 years later than I should have been. And here's the thing, weight bias in healthcare impacts diagnosis and treatment options for patients. And I'm not alone in this experience. Take a 54-year-old woman, we'll call her Jane, for example. Jane was often experiencing abdominal bloating and weight gain, and after consulting with her healthcare team, they diagnosed her with obesity without ever conducting a physical examination. But after a CT scan, they discovered a 46-kilo mass in her abdomen, a tumor. So her weight bias diagnosis almost cost her from getting the preventative care that she needed. And the thing is, this isn't just about one person. It's about a system that dismisses the concerns of patients based on assumptions about their weight. And the truth is, weight bias can lead to serious, even deadly consequences, just like in Jane's case. So what can we do about this? As healthcare providers, you hold the power to make a real difference. So here are 3 things you can do to address weight bias and improve care for everyone. The first step is to acknowledge your bias. Understand that bias exists, both in ourselves and in the healthcare systems we work in. Recognize that assumptions about your patient's weight, identity, or behavior can impact the care you provide. For instance, in Jane's case, the healthcare team assumed her weight gain was due to her diet, when in fact it was due to a serious medical condition, and that bias prevented them from giving her the care she needed. The next step is to unlearn your bias. This means challenging your long-held beliefs, educating yourself about different cultures, and recognizing the harm caused by bias. If Jane's healthcare team had unlearned their bias, they would have focused more on her symptoms and conducted further tests, rather than jumping to conclusions based on her weight. And finally, combat your bias. Put what you've learned into action. Advocate for your patients, interrupt biased behavior when you see it, and ensure everyone receives the care they deserve. In Jane's case, this could have meant questioning their assumptions and digging deeper into her abdominal pain, which would have resulted in getting a proper diagnosis sooner. So whether you're a healthcare provider looking to provide more equitable care or a patient hoping for more inclusive treatment, this is a journey that we're all in on together. So let's work to reduce health disparities by acknowledging, unlearning, and combating the bias that's harming our healthcare system. And let's keep this conversation going. I want to hear from you. So comment below and share your thoughts or experiences with weight bias in healthcare. Have you faced something similar, or maybe you have tips for combating bias? I'd love to hear your lessons, so drop them below. And make sure to subscribe to the Enhanced Black Women's Health YouTube channel and join the EBWH community for more resources and support on how we can create equitable healthcare for everyone. Thank you so much for watching, and I'll see you in the next video.